So the question often comes up involving concussions or traumatic brain injuries. How long is it going to take to resolve my claim or my loved one's claim? And just the other day, one of our attorneys was discussing that with a potential client who asked that very question. And the way the attorney explained it, and this can be helpful for you too, but remember, it's general information, and so you need to call our office to have one of our attorneys analyze your specific situation. But the attorney explained and said, the very first thing is getting the proper diagnosis, and that's where, quite frankly, most doctors miss it. I mean, the statistics show that more than 50% of all concussions are missed at the emergency room. Even some of the most sophisticated tests out there will miss many concussions because the best we have available it's not 100% foolproof. And so there's so many times that concussions are missed. And even when they're diagnosed, most doctors have no treatment. So they say, well, what's the point of diagnosing it if you can't offer any treatment? You just make the patient depressed, okay? And so, anyway, the most important thing, as the attorney explained, is to get the proper diagnosis done by the top experts. And then it switches over to what's the most effective treatment. And that's an area that our attorneys, and I'll tell you, because we understand this area so well, can tell you that there's not one silver bullet, not one magic answer for everybody. If there was, trust me, I would just give it to you right now. But we're aware of the options. We're aware of what's worked best for our clients in the past in this situation, and when there's a different diagnosis in this one. And quite frankly, we work with our clients and we have them try everything that's been proven to help. And so sometimes it might be hyperbaric oxygen therapy. That's where you get in a tank and you have oxygen. It's like pressurized. I mean, I've done it myself. Everything I'm going to tell you, I've tried out myself just so I know how it works and I can tell my clients. Another one, which is related to that, is exercise with oxygen therapy. They hook you up to a big bag of oxygen, got a mask on, and they put you on a treadmill or on an exercise bike, and you do that for 20 minutes. I've done that, and wow, I mean, I didn't have a brain injury, but wow, I could tell the difference. There's all kinds of kind of stress testing where they kind of stress the brain. It's kind of like exercising an arm, increase the blood flow, and then it promotes healing. People of course have heard of other things like biofeedback and stuff, but I'm talking about things beyond that we've seen help our clients even more than the traditional kind of things that might be available in a local concussion center, which I won't name, but it's got a hospital name attached to it, and they do a good job, but they don't do a great job. I mean, they can diagnose and they give a few treatments and then they say, you're done. No, they're not done. They're just starting. And so anyway, and even a very outstanding hospital that, again, I won't name, but they're well known, we actually have clients that, because of our assistance and referrals, they get better than even the treatment at the so-called best in the state. And that doesn't mean they're not good, but there's some treatments available that the best in the state are not using right now, or they have to refer out for because they don't do it in-house. So again, all those things can result in it taking longer to settle your case, but what's the most important if you've suffered a concussion or traumatic brain injury? Is it get a check for $10,000 tomorrow and live in a life of hell for the rest of your life? Or get the best treatment available, which, by the way, ends up getting you a lot more money than trying to just grab a check and run and suffer the rest of your life. So we focus on getting you better, the best treatments available, and we're talking about cutting edge stuff. And then after that, we get you the most money that you deserve. So remember, call us. You've got headaches, short-term memory loss, any of the typical symptoms of concussion, and we will make the top referrals. We'll guide you through the process so that you have a decent shot at recovery physically and then financially. Call us. The information's free. The referrals are free. And I hope you can tell we really have an emphasis on helping clients that have suffered concussions or traumatic brain injuries, and that may include you.